Good afternoon. It's January the 2nd and it's the year 2022. Gordon, don't make that noise when on the camera, please, sweetheart. There's a good boy. Today I wanted to quickly go over why you should take your medicine. Because I'm not doing particularly well at it, because as you saw in my last video, I decided to reduce it from 60 milligrams to 40, and 60 is the maximum dose, which I take for my OCD, and that didn't go too well. But yesterday I woke up a bit late. I forgot my medicine. I didn't realise until the evening when I started to feel really bad. So I've been on fluoxetine, which is for OCD and other things. You've probably heard it prescribed before, depression and other things. Basically, it helps me with OCD and it's quite good. Probably relieves 20% of the symptoms and the struggles and the compulsions that I get. Why it's important to take it? Well, I don't know why it's important to take it, but I do know what happens when you don't take it. Basically, there's probably other people out there who are on medication or thinking about taking medication. I'm not able to give you a doctor's opinion because I'm not a doctor, but I am a user. A user sounds like a drug problem. Well, I suppose I have actually, because when I stopped taking it, it's not particularly good. I've been on it 10 years, so I've got a lot of experience in knowing what happens when you don't take it. And also I've tried to reduce it, and that's when I start to think maybe these things are addictive. You always think of addictive as in, oh, it's really, I've got to have more of that. But I think it's an addiction in the sense that your body can't give it up. So when I try to stop my medicine, all hell breaks loose. So last night I started to feel dark, I call it dark, and frustrated, and everything's going a bit wrong. And I don't know why. Everything should be good. And then I realised, I've forgotten to take my medicine in the morning. And that's a fatal mistake to make. When you do that, you certainly pay the price, because it takes a little bit of time for your mind or your chemicals to balance back up again. So I'm going to try and explain how I understand the medicine to work. If you imagine a big clock with a pendulum, and it swings left and right, left and right. That is the normal state of a person's mind. As this swings left and right, it's not seconds, it's like, say for example, a day or 12 hours. If you've got OCD, for some reason the pendulum isn't quite swinging smoothly, and you need the medicine to give it a little tap, just a little push. So you take your medicine, say 8 o'clock in the morning. As the pendulum sweeps through the day, it sweeps all the way back to 8 o'clock. So it's going to go on its return stroke, gets a little tap, keeps it going, its full loop. And it comes back again, 8 o'clock, take your medicine, gives it a good tap, keeps it going, back again. And that keeps the pendulum cycling or looping normal. And that's what a normal person's mind, or the chemicals in their mind, are like. Now, as soon as you miss your medicine, I've missed one there, didn't I? As soon as you miss your medicine, like say I did yesterday, it starts to go a little bit out of time. And then everything starts to feel a little bit weird and strange. And of course, if you then take it, it like doesn't quite correct itself. It takes a little bit of time to correct itself, and it eventually starts to get back again. Now, why do we need those medicines? Why do we need to keep giving that pendulum a tap? Well, it's not a pendulum, it's just an analogy, it's just one way of understanding it. There's obviously something that's lacking or incorrect in the person who's got OCD in their brain. But that's how I understand it works. And I do know the effects when I don't take my medicine, like yesterday. By yesterday evening I was feeling frustrated, annoyed, and I felt that. I felt that bubbling up inside. And that's probably because I didn't take my medicine that morning, and also as a side effect of not taking it. So that's why it's very hard to get off of it. And then today's been a bad day, probably because I didn't take that medicine yesterday. Yes, this morning I did take it, and that, as I've seen in a minute ago, it starts to correct it, but it takes a little bit of time. So the consequences of me not taking that tablet yesterday were I started to feel dark last night, bad, things are wrong, nothing's going right, I can't get things right in my head. And then this morning I woke up feeling something's wrong, frustrated with everybody and everything, and can't explain it, but put it this way, when I'm driving, I'm annoyed with everybody. I'm frustrated with the person in front. Come on, get out of the way. And I'm not normally like that. I'm normally quite a relaxed driver. Everything is annoying me. Everything is frustrating me. Everything's making me irritated, and I'm feeling quite low. I'm also very aware that it's not a good time for me to be around friends or people who care for me, because my compassion and caring goes out the window because I'm having obsessions all the time and I can't function. I'm basically thinking repetitive obsessions. I'm twitching more. I'm having what I call complexes. Complexes were mind obsessions. Pure O, they probably would call it. Basically, things aren't working in my head. I think everything's against me. Everyone's against me. Everything else is going wrong. It's a really, really dark place to be. And it proves the power of medicine. And I really need to start to be very punctual with my medicine. And also, I've learned from other people that taking your medicine at a specific time each day is crucial. And that's something that I'm not always keeping to. So I'm going to start to try to polish up on that, because mine is all over the place. It works, but it's maybe got room for improvement. So that wasn't a good feeling today. And then, on top of that, my little cat Lily had an accident on the road and she's injured. Now, she's going to be okay. She's downstairs in the little room getting better. And that broke my heart and made me feel sick, and it compounded to everything else, because obviously, I do love my little ones and they're very special, and thank the Lord that she was okay, because it could have been a lot worse. I saw her spat across the road basically, and we live near the main road. I don't really want to go into the details of it, it's not important. The important thing is that she's okay and she's doing really well. She's just eating a yogurt, so she must be okay. So, a very quick overview of why it's important for me not to miss my medicine. But I will quickly go over a few genuine reasons and facts and various things that I've learned, because I did a little bit of research and I want to share that with you. So I'm just going to read out a few of the symptoms. Missing doses of fluoxetine may increase your risk for relapse in your symptoms. Stopping fluoxetine abruptly, which is basically what you're doing when you're missing it, may result in one or more of the following withdrawal symptoms: irritability, nausea, dizziness, vomiting, nightmares, headache, and paresthesia. Don't know how to say that, but prickling, tingling sensation of the skin. Sounds quite nice. They did a test on 107 patients who had been successfully treated with Prozac. And over the course of 5 days, all of them received an inactive pill as a substitute with their medication. And this was compared with another 5-day period where they took their regular medication. So basically, they tricked them, didn't they? They basically gave them a pill and they thought it was Prozac. And they didn't know, so they weren't taking Prozac for those days. During that time they were taking the inactive tablet, patients had somewhat severe side effects. The most common symptoms reported were dizziness, unusual dreams, nausea and fatigue, and irritability was also common amongst them all. Certainly tired and irritable is how I felt today, annoyed with everything, including myself. The bottom line to this study is that doctors and patients need to pay more attention to the proper dosing schedules for antidepressants. And I think I'm feeling a bit better now. Very easy to underestimate medication and just think, I can stop that. Because I was really excited last week to just automatically reduce it myself. I don't know why I touched my boob. My tit, my chest, my pec, my body. See, that's me being Tourettical. Come on, we'll get rid of that out. I lost the plot now. I'm saying it's what I do. It's a fly. So clear. So this is what it's like. This is what it is like. I'm really good at suppressing this in public. And I'm just gonna take a moment. Right. I don't really feel on form today. I'm struggling doing this video, and I'm determined to do it. It's probably going to be a bad one, and I don't really feel I've got any energy or motivation, and I feel annoyed. But I guess this is probably good to do this because this is what it's like when you don't take your medication. I did take it this morning, so it's starting to kick in a bit now. So I'm sorry it's not a very good video, this one, but I'm still going to put it online because part of what I'm trying to do is have a video journal. I'm hoping to make progress along my way, and I encourage you to join me in that. I can't even think my words today because my mind is just a bit rubbish, to be honest, today. It's a bit scrambled egg. Anyway, thank you for supporting. Please subscribe if I haven't put you off with this terrible video.